Good morning and welcome to Module 151. This module is a lot of fun and there's a lot of information and it's fast. It's 16 days. So please, please, please do not get behind in your work because this is not a tiny module like the one that we just did, 158, professionalism, but it still is going to go by fast because we're going to be going through the Kins Manual, which is the same book that you used last module. The little green one here, it'll be the same book and the same workbook or study guide, whatever you call it. So I'm actually going to be doing a quick lecture on chapter 1 and 2 in your Kins Manual because we're just going to lecture these modules and then we're going to move straight into chapter 3 because we want you guys to get into the good stuff. So without further ado, I am going to share my screen. Okay, so chapters 1 and 2 in module 151. Chapter 1's title is The Professional Medical Assistant and the Healthcare Team. That has a lot to do with the medical assistants themselves, but we are administrative medical assistants. So we're going to be putting the focus on that. And then chapter 2 is Therapeutic Communication. So let's go ahead and get into it. So what are the responsibilities of the administrative medical assistant? Answering the telephone, managing patient scheduling, which we just did in SIM charting, documenting accurately in the patient's health record, again, what we did in SIM charting, managing facility correspondence, and following legal and ethical principles. Okay, so customer service. When you think about customer service, you often think about, Walmart, JCPenney, Super One, Dillard's. The sales associates are to give you good customer service. Well, customer service is all the way across the board, including a medical clinic, because they are the customer. They may be a patient, but they're a customer. They're the reason why we get paid. So we're going to talk about customer service. Medical assistants must provide excellent customer service. The customer is the one who purchases goods for services. They're purchasing their health care. Patients are considered external customers. Internal customers are people whom you deal with in the workplace environment. Customer service, whatever we do for our customer to improve their experience. So think about as a front office medical assistant. You're sitting at the desk, you're answering the phone, you're greeting patients, and you're just gloom and you answer the phone. Hello, this is whatever clinic. How can I help you? That's not good customer services. Patients don't want to hear that. They want to hear a cheerful person. Practice smiling while you talk, because I'm smiling right now. You can hear the smile in your voice. So remember how you expect people to take care of you as a customer and bring that to your job. So what are some characteristics of professional medical assistants or AMAs, administrative medical assistants? Professionalism, courtesy and respect, empathy and compassion, tact and diplomacy, respect for individual diversity, honesty, dependability, and responsibility, and professional appearance. So we're going to move straight into chapter 2, Therapeutic Communication. So types, and diversity in communication. Types of diversity can be nationality, race, culture, ethnicity, I'm sorry, I have trouble saying that word, social factors. Individual diversity factors can be language, age, religion, economic status, gender, and appearance. You guys can't let any of these factors influence you. Doesn't matter what somebody looks like, Doesn't matter what gender they are. It doesn't matter their age. You treat everybody with respect and courtesy and kindness. So let's talk about nonverbal communication. What does nonverbal communication encompass? Body language, gestures, mannerisms, appearance, self-esteem and confidence, and facial expressions. So if you approach somebody that has their arms crossed, that's not very welcoming, right? Look at our little fella down here in the bottom left corner. He doesn't look happy at all. That is no way to greet your customer patient. You need to make sure that you're giving good body language, nice gestures, that your manners are on point, that your appearance is professional. So now we're going to talk about cultural differences and spatial distance. If you are interacting with a person from another culture group that you are unfamiliar with, follow the other person's lead. Use gestures cautiously. Refrain from touching a child's head. And then let's talk about some different types of spaces. So intimate or personal space is 0 to 18 inches. A casual personal space is 18 inches to 4 feet. Social business space is 4 to 12 feet, and public space is a distance greater than 12 feet. Now, this is very important because in your healthcare facility, you're going to be dealing with all culture groups. Just be very careful, be friendly, and follow their lead. So next we're going to talk about written communication. So types of verbal communication include written messages, which can be phone messages, letters, and emails. Online information and media, for example, an informational flyer, all written communication. So let's talk about oral communication. Types of verbal communication styles are passive communicators, aggressive communicators, passive-aggressive communicators, manipulative communicators, and assertive communicators. Therapeutic communication is next. So as you can tell by the ears, active listening is the most important therapeutic communication technique. I try to remind myself, talk less, listen more. You need to fully concentrate on what is being said and how it is being said, and show interest verbally and non-verbally. Guys, everybody has probably encountered a person that you were trying to talk to and they didn't look interested. That just is such an uncomfortable feeling. So we need to make sure that we're actively listening to our patients. Next, we're going to talk about open and closed questions or statements. An open question asks for general information. Encourage patients to respond in a manner in which they find comfortable. Closed communication asks for specific information, limits the patient's answer to 1 or 2 words. So let's talk about what is one of the things that you get asked at the front desk of a medical facility that would be a closed question. I'm going to give it to you. Has any of your information changed? Nope. So that is an example of a closed question that everybody gets asked, I think, every time you go and check in at a medical facility. Let's talk about anger. Not your anger, but maybe your patient's anger. It is crucial to know how to handle and diffuse the situation. It's important to make sure the person feels heard, demonstrate empathy, use active listening, And then you follow the policies for dealing with angry individuals. So if someone's angry, they approach you and they're angry. Instead of reacting with anger, you can say things like, I am so sorry, Miss Smith, that you feel that way. Let me see what I can do to help you. Or I'm so very sorry that that happened. Let's look into it more. Can you just give me a few minutes? Things like that to comfort them, because guys, patients, you never know what's going on in their lives. So you always have to be careful to diffuse the situation and not throw gasoline on the fire, as they say. So let's talk about the development of Erikson's stages of psychosocial. I'd never heard of these things before. I saw it in our book, but we're just going to go over them. So, number 1, 0 to 1.5 years of age, trust versus mistrust. So, these are the stages. 1.5 to 3 years old, autonomy versus shame and doubt. 3 to 6 years old of age, initiative versus guilt. 6 to 12 years of age, industry versus inferiority, identity versus role confusion, 12 to 18 years of age, intimacy versus isolation is 18 to 25, general activity versus stagnation, 26 to 60, and ego, integrity versus despair is 60 years of age and plus. Communicating with 3-year-old child is different than with an 80-year-old adult. So we kind of have to look at where they are as individuals. Of course, you're going to deal with a 1.5-year-old much different than you're going to deal with an 18-year-old. So those are just great things to keep in mind. So we're going to be talking about Kubler-Ross's stages of grief and dying, which means terminal illness. Okay, well, hang on, guys. It's cute to have a video in the PowerPoint slide that's just like this, but it won't let me go to the next slide until it plays completely out. So we'll take a deep breath and wait for our sad little video where he's comforting her. I think that's so very sweet. Okay. We'll go around it. Sorry about this little hiccup, but there we go. We overcame that hiccup. So some of the stages of grief and dying or terminal illness is denial, anger, bargaining, depression, and then acceptance. Let's talk about personal boundaries with communication. Put a fence up to signify boundaries. I'm just saying because I was very, very proud of that creativity. Remember that certain topics are inappropriate in an office work setting. Retain a professional relationship with your patients. Do not discuss religion, politics, or relationships with your patients. Do not gossip with the patient. Befriend them on social media or share personal issues or engage in a flirty or romantic conversation. I think we all pretty much know this and it's common sense, but here's your reminder. You need to be professional. Next, we're going to talk about Maslow's hierarchy of needs. Again, this is something I had never heard of before this book, and we're just going to take a quick look at it. So sociological needs is at the top of the chart, then safety needs, love and belongingness needs, esteem needs, cognitive needs, aesthetic needs, self-actualization needs, and transcendence needs. Now, I'm not sure that some of these things are needs, but for example, if you have low self-esteem, that really does affect every part of your life. So self-esteem really is a need. Love and belongingness, I think that that's a need. You must be safe. Psychological is important. So aesthetic needs, I don't know if you are like this, but I need my makeup. So that is a need for me, where some people don't have that need, but there may be the need to have their nails done or their hair done. So that's just a little bit about, personal needs. Next, we're going to talk about some defense mechanisms. Unconscious mental processes that protect people from anxiety, loss, conflict, or shame. So here are the types of defense mechanisms: denial, repression, regression, displacement, projection, suppression, splitting, reaction formation, and rationalization. One of the things that I struggle with on this list is going to be projection. I can be angry at someone. Let's just say that I'm angry with my neighbor, but instead of taking my anger out on my neighbor or telling her what I thought, I may get grouchy with my husband and children. That is projecting my anger onto someone else that doesn't deserve it. So some of these are really, really, really good to think about. Suppression. I also suppress anger. I might get angry over something and not say anything, and then anger over another thing and not say anything. And so I'm suppressing it until one day my volcano is full and I just explode and everybody's looking at you like, Mom, what's your problem? And I told you to clean your room for 6 months and I've been, so that's really not fair to have that sort of reaction. So suppression can really, really cause an explosion of emotion. So it's important that we deal with our emotion at the time and in a respectful way. So let's talk about coping mechanisms. Stress is a condition that causes physical and or emotional tensions. There's two types: adaptive, which is healthy, exercising, eating healthy, talking with others. Maladaptive, it says healthy, but that's unhealthy. Hostility, aggression, denial, and drugs. Oh my goodness, I can't believe I didn't see that was a mistake on the PowerPoint slide. Sorry. Maladaptive is unhealthy. It's hostility, aggression, denial, and drugs. So please don't think that any of that's healthy. So let's do some questions. List 5 clinical and 5 administrative skills that are part of the job description for an entry-level medical assistant. So we're just going to do administrative medical assistant. So here are 5 duties: answering the telephones, managing patient scheduling, documenting accurately in the patient health record, managing facility correspondence, and following legal and ethical principles. So we said this in like maybe the first or second slide that we talked about, but these are the bulk of an AMA, administrative medical assistant's job. And remember, we talked about answering telephones with a smile on your face, because then it sounds like you're smiling and the patient / customer will get a better experience. So I want to add one thing. What is the scope of practice for medical assistants? So medical assistants can perform certain basic tasks without any supervision from a doctor or nurse. And scheduling appointments, they can also prepare instruments for examination, prepare exam rooms, and record vital signs. Assisting the doctor during procedures and minor surgical interventions is also within the medical assistant's scope of practice. So this is the medical assistant. What of these things listed here can an administrative medical assistant do? Schedule appointments. The rest of these things are out of your scope of practice. Can you be trained to do some of these things? Absolutely. Oh, excuse me. Absolutely, you can. But if you have no training or you don't feel comfortable, this is out of your scope of practice, except for answering the phone, scheduling appointments, things of that nature. But a regular medical assistant can do all of these things. So now we're going to identify 5 practices that are beyond the scope of practice for administrative medical assistants. Oh, let's go back. So let's identify 5 things that are out of your scope of practice. Let's look. Prepare instruments for an examination. That's out of your scope of practice. Prepare exam rooms. Possibly, but at this point, out of your scope of practice. Record vital signs, which means taking a patient's vital signs. That's out of your scope of practice, but you could put them into the patient's chart, which you learned in sim charting. Assisting the doctor during procedures, that is out of your scope of practice. So that is the end of our lecture. That was chapters 1 and 2 in module 151. I hope that you learned something and had a good time listening. I love those slides. I worked really hard on them, and they are how I do creativity and take care of myself. I love creativity. So you guys have a wonderful day, and I'll be seeing you soon. Bye-bye.